this is what we need to be able to do by the end of today's lesson. All of us will definitely know the 3 stages of rehabilitation. The names are really simple, so we're definitely all going to achieve this by the end of today's lesson. We'll all also be able to name and describe 3 treatment methods with some accuracy. We're going to focus on 3 treatment methods in today's lesson. Most of us will be able to not only know the 3 stages of rehabilitation, but also describe what's occurring during those 3 stages of rehabilitation to help our sports performer get back to their best, and to be able to accurately describe 3 treatment methods. Finally, the hardest bit about this really is using this information here to assess. So to be able to say, I would choose this particular treatment method for this particular injury, and this is why, and maybe I wouldn't choose this other treatment method, and again, this is why. So here's our definition of rehabilitation, really, really important definition. So rehabilitation, the process of restoring full physical function, after an injury has occurred. What that means is to be able to get back to, for our athlete to get back to full use of their joints, their bones, their muscles, their connective tissues, and to be able to use those effectively in a range of sporting situations. Effectively, to be able to use those damaged joints, bones, connective tissues, muscles, just how they did before the injury occurred. So one of the biggest things that people get wrong maybe with rehabilitation is to think that it's only about rest. And of course, rest is really important. Rest is one of the key areas for all training, and rehabilitation is no different. But rehabilitation is an active process. It requires much more than simply resting the affected area through the injury. So rehabilitation is all about getting our connective tissues back to how they were before the injury. So we want to restore the strength of the connective tissues, the flexibility of the connective tissues, the endurance of the connective tissues. So for these connective tissues to be able to deliver the strength of the muscles pulling on those bones and between the joints, to be able to do that over and over and over again if required in the sporting scenario. And similarly, to restore the ability of the connective tissues to deliver the speed that the muscles are creating, and to be able to carry those through to the joints in order for movement to occur. So if we're looking at the outcomes, the reason that we would take part in rehabilitation, these are the reasons. We're going to take part in a rehabilitation program in order to restore strength, restore flexibility, restore endurance, and restore the speed within the connective tissues. If an injured performer returns to competition, if it's too early and they haven't gone through the rehabilitation procedure that we're about to look at, the connective tissues are really susceptible to further injury, and this is that intrinsic risk factor that we've discussed before, the intrinsic risk factor of previous injury. If someone's suffered an injury and they haven't gone through the rehabilitation process and got all these things in the connective tissues back to where they were before, they're much more likely to suffer from an injury again. So I want you to have a quick link back now to a previously studied topic. This is something that we studied right literally at the start of the year, the skeletal and muscular systems, and we looked at connective tissues. So I want you to pause the video for 5 minutes, have a think about connective tissues and synovial joints. Try not to look at your notes. I want you to make a little list of, for a start, the name of the connective tissue that connects bone to bone, then the name of the connective tissue that connects muscle to bone, and finally, list the key features of the synovial joint. If you can, why each feature is important. That's probably the hardest bit. See if you can remember. Give yourself 5 minutes and come back to the video. Okay, so we'll come back to these ideas later. Moving on though to the 3 stages of rehabilitation, one of the fundamental outcomes for today's lesson. So once we have suffered an injury, and we'll look again, have a reminder about the injuries in a moment, we'd need some medical advice about how to get back then to playing. So we would take advice of doctors, maybe physiotherapists, perhaps surgeons, strength and conditioning coaches if we have them. And all these people will be able to advise us on the treatment and then the rehabilitation for our particular sports injury. And these are the 3 stages. So I said they had simple names: early stage, mid stage, late stage. The length of each of these stages is going to be dependent on the severity of the sports injury. So let's say we'd suffered a simple fracture. The early stage of rehabilitation, mid stage, late stage, might be quite lengthy. Once we get that plaster cast off that simple fracture, it might take another month, 6 weeks before we're ready to return to participating fully in physical activity and in sport. If we've suffered a sprain that isn't too severe, maybe the early stage might only take a few days, and we might actually be able to get back to full physical fitness within 2 or 3 weeks. So the length of these really depends on the severity of the injury in the first place. So the early stage is about gentle exercise. Now this obviously doesn't start immediately after the injury. If we've had a dislocation, then the next day we're not going to start gentle exercises. We're going to need to wait until that brace that we've had fitted for the dislocation or the slings come off. And this is now about getting back to sport once the original initial treatments have done their jobs. So we'd start with some gentle exercise, and the reason for these is to encourage the damaged tissues to start to heal. Obviously, if we've had a dislocation of the shoulder joint, for example, and our arm's been in a sling, the tissues will have started to heal, but they won't have been moving through their full range of motion while immobilized through the use of a sling, for example. So these gentle exercises, first of all, are going to start to help these damaged tissues to heal. In the mid stage then, this is when we start progressive loading. So the exercises would become a little bit faster. We might be using weights as a load. There might be more dynamic movements involving more speed, slowly, progressively building all these features up. So slowly increasing the load, the speed, the range of movement that we're taking the joint through. And we're going to be putting that load on the connective tissues and on the bone, and this is going to develop strength that will have been lost while the area's been immobilized. And finally, in the late stage, this involves like sport-specific exercises and drills. Again, done gently to start off with, gradually increasing in intensity and duration in order to get the body back to where it needs to be to go back, training with the hockey team. So these are the injuries specifically that we looked at in our previous lesson. And you finished a table off for homework where we're looking at the treatments, and hopefully that table has highlighted to you that for simple fracture, stress fracture, dislocation, sprain and torn cartilage, one of the treatments for all of those is strengthening exercises for the surrounding connective tissues. Exercise-induced muscle damage actually is the only injury that we looked at that doesn't require some strengthening exercises to support these surrounding connective tissues following an injury. So we'd be looking to take part in all of those rehabilitation stages following any of these injuries. So for example, if we've suffered our torn cartilage, then we will have already followed medical advice. We would have already followed the Price protocol in order to reduce swelling and pain. We would have already taken anti-inflammatory drugs in order to reduce swelling and pain. We would have already been wearing a brace or some sort of strapping for immobilization to support the area while it heals. Maybe we would have surgery, and once all those processes have been followed, then the doctor, the physiotherapist, the strength and conditioning coach would advise us then to go through these stages of rehabilitation. Similarly, for our dislocation, yes, we would have sought medical advice already. The medical professional would have put the joint back into place. It would have been immobilised through a strap-in or a sling using crutches. We would have taken anti-inflammatory drugs to reduce swelling and pain. And then once all that's done, we would start through this rehabilitation process using the advice often of physiotherapists, strength and conditioning coaches to take us through these stages. So early stage again, gentle exercise which encourages healing. Mid stage, progressive overload encourages connective tissues and bone to strengthen. And late stage, including sport specific exercise and drills to ensure that we're ready to return to full training. So earlier in the lesson I asked you to have a look back, think about that skeletal and muscular system and to answer a few questions. So if you want to check that work now. So connective tissue that links bone to bones, hopefully we all got that, that's ligaments, and the connective tissue that attaches bone to muscle, again, hopefully we're all able to remember that, is tendons. And then the features of a synovial joint. We haven't looked at this for a while, so this might have proven a little bit more difficult. So hopefully you were able to identify ligaments as one of the key features of a synovial joint. So on this picture here, this is our ligament, that tough band. It's slightly elastic connective tissue, and it's connecting one bone to the other bone to stabilise the joint while it moves. The second feature here, we've got our joint capsule. That's this blue area here on this diagram. The joint capsule, that fibrous sac with the synovial membrane on the inside, which on this diagram here is this pinkish line here. That joint capsule, it encloses and strengthens the joint, and obviously the synovial membrane is the thing that secretes the synovial fluid into the joint cavity here. And then that brings us on to the joint cavity, this gap between the two articulating bones into which the synovial fluid is secreted. That synovial fluid, as we know, lubricates the two ends of these joints, reducing friction. It nourishes this articular cartilage as well. And again, that brings us onto this articular cartilage, this smooth tissue covering the surfaces of the two articulating bones, which reduces friction and absorbs shock, allowing friction-free movement. The last feature that we looked at when we looked at synovial joints was the bursa. Don't let this spelling confuse you. This is because it's pointed out multiple bursa. And again, the bursa, so fluid-filled sacs, stopping the bone, rubbing on the tendon. So we can see here we've got the femur, the tibia, and the fibula, so hopefully we're able to identify that this is the knee joint. And we've got the bursa here, these fluid-filled sacs that are preventing this ligament here from rubbing on the bones. Okay, so hopefully that's been a good little bit of revision on the skeletal and muscular system, specifically on bones. If you look on your OneNote lesson now, you've got some activities to go through in order, let's have a look back, to now move on to being able to accurately describe 3 treatment methods and assessing those treatment methods for different sports injuries.